How would you deal with bags and creases under eyes like these? I'm a 27-year-old male, about to turn 28. Over the last month or two, I have begun to notice bags and creases under my eyes. I'm an actor and regularly get headshots taken, so I can see the difference from now to a few months ago. It is pretty dramatic. I suffer from thinning hair, so I have been taking finasteride and using minoxidil for the past few years. Could either of these drugs have helped to cause these changes under my eyes? Are there treatments that can help reverse this?
Thank you for your question. You're 28 years old and you've noticed that in the course of approximately a year you've developed some creases and bags under your eyes. You also state that you're an actor, you get a lot of headshots done, and in addition you are suffering from thinning hair, and you've been taking finasteride and minoxidil for this, and you're asking, can either of those drugs contribute to the wrinkling under the eyes? Well, I'll give you a little bit about my background, and it's interesting you're asking me this question. I'm a board-certified cosmetic surgeon. I'm also fellowship-trained oculoplastic or oculofacial plastic surgeon. It means I first trained in eye surgery before becoming a specialist in complex eyelid surgery. This is a super specialty. It's in distinction to general plastic surgery, which is more of a broad specialty in the field of plastic surgery, where they get trained in a lot of things but don't specialize as intensively on one area, such as in oculoplastic surgery. In addition, I'm also a hair loss specialist, and I'm the founder of a company called Tricostem Hair Regeneration, which is a solution we've developed over the past several years for non-surgical hair thinning. And so we see a lot of patients who come to us from around the world for hair loss and who take finasteride as well as minoxidil. For many years we were doing hair transplant as well prior to the development of hair regeneration. So to begin with, let's address the question about the drugs and whether or not there's an impact on the wrinkles. To this point, I have not seen any direct correlation between the use of finasteride or minoxidil and causing skin irritation. Now, there's one thing that might be worth thinking about, is that if you are applying minoxidil, make sure you wash your hands after you apply the minoxidil, especially if you're using the solution. Minoxidil solution, as opposed to foam, has a derivative called, or a chemical called ethylene glycol, which is basically a diluted version of the ethylene glycol that's used in antifreeze. Now, if you happen to be touching your eyelids after applying the minoxidil, you might be drying out the skin and causing some irritation. It's very important to understand that eyelid skin is the thinnest skin in the body. It's very sensitive. It's sensitive to sun damage. It's sensitive to dryness. It's sensitive to all kinds of environmental factors. It's also sensitive to your hydration, your nutritional status, your stress levels. The eyelid skin can be very indicative of your health. When we look at patients, we can almost always tell who's a smoker just by looking at the skin quality of their eyelids. Now, that being said, as a younger man who is in an appearance-intensive field, you may want to also look at the other factors, as I mentioned. Because eyelid skin is the thinnest skin in the body, you have to ask yourself, are you spending more time in the sun? Are you getting enough sleep? Are you smoking? So you want to take away all the toxic effects on your skin before you talk about doing anything that's more of a procedure. Now, for someone young like yourself, we would consider using something like platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it contains the healing growth factors needed for wound healing. And we have found we've been able to help patients improve skin texture and quality with platelet-rich plasma. Now, one of the things that I always explain is that one treatment may not be enough, but we do often combine this treatment with topical treatments. Usually for someone young like yourself, we don't use lasers because it's not, I think that lasers done too aggressively or too early can actually thin the skin more than thicken the skin. Just the right amount of heat can give you some benefit, but I usually wait before considering laser on a younger person. I would say that you would probably be a good candidate for this combination therapy of platelet-rich plasma and topical creams. We have an under-eye cream and various other products that we've developed in our practice that we use for our patients. But it's important to look at the foundation, look at what you're doing that might be contributing to this from a lifestyle perspective. So I hope that was helpful. I wish you the best of luck, and thank you for your question.